Did the media play puppet master, orchestrating our emotions during the COVID-19 pandemic? A provocative question, indeed. Throughout history, media has been a potent tool, shaping public perceptions and influencing societal sentiment. The COVID-19 pandemic was no exception. Across the globe, we consume news and updates with a voracious hunger, our hearts pounding with fear, our minds swirling with uncertainty. But was the media merely the messenger, or did it become the maestro, conducting a symphony of fear and compliance? From the uniformity of messaging across media outlets to the downplaying of vaccine adverse effects, from framing alternative views as misinformation to fear-mongering through statistics, the media's role during the pandemic raises many questions. Leaked documents, whistleblower testimonies, and credible studies offer insights into these questionable practices and agendas. Join us as we delve into the murky waters of media manipulation during the unprecedented COVID-19 pandemic. Let's unpack this media monolith as we retell a history marked by an invisible enemy and a world held captive. From New York to New Delhi, the media narrative on COVID-19 bore a striking similarity. As the world grappled with the uncertainty of the pandemic, there seemed to be an uncanny uniformity in the messaging echoed across global media platforms. This consistency raised eyebrows and sparked questions about coordination and potential censorship. Leaked documents from the Trusted News Initiative, or TNI, shed some light on these concerns. The TNI, a coalition including major media outlets like the BBC, Reuters, and even Facebook, had made agreements to combat what they termed as misinformation. But what did this mean in practice? As it turns out, this included suppressing dissenting voices. Whistleblower comments indicated that even legitimate scientific debates were sidelined, branded as misinformation to maintain a unified narrative. This narrative was not just about what was being told, but also about what was being emphasized. A whistleblower from CNN provided internal emails showing directives to maintain a focus on fear-driven coverage of COVID-19. The emphasis was on promoting vaccines over alternative narratives. But why would media outlets want to suppress differing viewpoints, especially in a situation as dynamic and uncertain as a pandemic? The answer may lie in the power of a unified narrative. A single, consistent story can be a powerful tool to guide public perception and behavior in desired directions. It can provide a sense of certainty in uncertain times, even if that certainty is built on a selective presentation of facts. Yet while a unified narrative can be comforting, it can also be constricting. It can limit the scope of our understanding and close off avenues for questioning and debate. In the context of a global pandemic where new information and research were emerging at a rapid pace, this approach could potentially hinder our ability to adapt and respond effectively. The question arises, was this a global effort to combat misinformation or a stifling of scientific debate? As we delve deeper into the media's role during the pandemic, we'll continue to uncover the nuances of this complex interplay between information, power, and perception. Vaccines emerged as the heroes of this narrative, but were we told the whole story? As the pandemic progressed, vaccines were lauded as the ultimate solution, the silver bullet, if you will. But amidst the applause, there were hushed whispers of adverse effects that didn't quite make headline news. Consider the data from the Vaccine Adverse Event Reporting System, or VAERS, which recorded thousands of severe side effects related to the vaccine, including myocarditis and neurological disorders. A study in clinical immunology in 2021 suggested that these reported cases were just the tip of the iceberg, as underreporting biases might have left a substantial number of adverse events undocumented. But why were these side effects not given the attention they deserved? Could it be because they didn't fit neatly into the prevailing narrative of vaccines as our savior? Enter the whistleblowers, the brave few who dared to break the silence. One such voice was that of Dr. Peter McCullough, a cardiologist and outspoken critic of vaccine policies. He was deplatformed after discussing the scientific data on risks associated with mRNA vaccines. His voice, along with others, was drowned out in the clamor of the mainstream narrative, silenced under the guise of combating misinformation. Leaked emails from social media companies revealed a disturbing trend of government pressure to censor posts discussing adverse effects. This raises an alarming question. Were these platforms used as instruments to suppress dissent and maintain a unified narrative? In the face of these revelations, we're left to ponder the integrity of the media's coverage of the vaccine rollout. Was it an objective portrayal of facts? Or was it a carefully curated narrative designed to downplay certain aspects while amplifying others? This brings us to a disconcerting question. Was the media's vaccine narrative biased? As we delve deeper into this history retold, we must question the narratives we've been fed and seek the truth, no matter how uncomfortable it may be. In this pandemic narrative, the villains were not just the virus, but also the dissenting voices. As the world grappled with the pandemic, the media landscape became a battleground of narratives. One of the key casualties of this war of words and ideas was Dr. Robert Malone. Not just any voice, but a respected scientist who was instrumental in the creation of mRNA technology. When he voiced concerns about vaccine safety and mass vaccination strategies, he was met with widespread criticism and ultimately deplatformed from major platforms. One might ask, why would a voice of authority and expertise be silenced? To further add to the intrigue, let's pull back the curtain on the leaked Twitter files. These documents revealed a disturbing alliance between U.S. government agencies such as the CDC and media platforms. Together, they worked to flag and suppress dissenting views. It appeared that the term misinformation was being used as a handy tool to mute voices that did not sing in harmony with the dominant narrative. Consider, for instance, the hit piece on Dr. Malone published by The Atlantic in 2021. It was later found to be funded by entities with financial ties to pharmaceutical companies. This raises a significant question. Was the media being used as a weapon to maintain a particular narrative and discredit anyone who dared to question it? It is important to remember that science thrives on debate and dissent. It is through the rigorous questioning of established ideas that we achieve breakthroughs and advancements. When we stifle these voices, we risk creating an echo chamber where only one narrative is allowed to flourish and all others are systematically eradicated. So, we are left to ponder. Were these dissenting voices truly spreading misinformation? Or were they simply challenging the prevailing narrative? Were they suppressed because they posed a threat to public health, or because they threatened a carefully constructed narrative? This begs the question, were alternative views unfairly targeted and silenced? Fear is a powerful motivator, and it seems the media knew how to wield it. This isn't a statement plucked from thin air, but a reality underscored by the leaked report from the UK Behavioural Insights Team, or BIT. This government advisory group, in an unexpected twist of transparency, admitted to a strategy that would make the hair stand up on the back of your neck. They exploited fear, deliberately stoking the fires of anxiety and dread to ensure compliance with lockdown mandates. Their document suggested a strategy that was as simple as it was chilling. They amplified the worst-case scenarios, the doom-laden predictions, and the dire warnings, while simultaneously downplaying the positive data, the glimmers of hope, the successes. This, they believed, would achieve a desired behavioral compliance. In other words, a fearful public is a compliant public. But it wasn't just the narrative around lockdowns that was manipulated. The reporting on case counts was also a masterclass in fear-mongering. Remember the daily tallies, the rising graphs, the relentless ticker of cases and deaths that became a constant backdrop to our lives? These numbers, devoid of context or nuance, were presented in a way designed to stoke fear, to keep us glued to our screens, to keep us compliant. It's important to remember that statistics in themselves are not inherently good or bad. They are merely tools, numbers that can be used to inform, to educate, to guide. But in the hands of those with an agenda, they can be twisted into weapons of fear. The daily case counts, the infection rates, the death tolls were all wielded with a singular aim: to keep the public in a state of fear, to keep us compliant, to keep us under control. This leads us to wonder, did the media use fear as a tool to control the narrative? As we delve further into the depths of this question, we uncover a myriad of unsettling truths. But remember, the aim here isn't to spread fear, but to illuminate, to question, to challenge, and ultimately to empower. As we pull back the curtain, a different picture of the media's role in the pandemic emerges. We've traversed the landscape of uniform messaging, revealing a global echo chamber that stifled dissenting voices and curated a singular narrative. We've delved into the silencing of discourse around adverse vaccine effects, unmasking underreported data, and the deplatforming of experts. We've touched on the framing of alternative views as misinformation, unearthing the deplatforming of qualified experts, and government influence on content suppression. And we've explored the fear-mongering through statistics, exposing the manipulation of data to drive compliance. This paints a picture of a media landscape that, in many ways, was less a beacon of truth and more a tool for shaping public perception and behavior. If you're intrigued by the unconventional, eager to challenge historical norms, and ready to explore the charted but with a different lens, don't forget to like, share, and subscribe.